In this video, I want to talk to you about something that I hear all the time from legal nurse consultants, whether you're just starting or maybe you've been doing it for a while. How do you know what is relevant in the records? How do you know what to put into your chronology and report to ensure that you're giving the attorney the most value possible? Again, I hear it all the time, and we talk about it a lot in Catalyst, but I wanted to give you guys some free coaching and mentorship today so that you can understand a little better of how to know what's relevant in cases. Now, stick around because toward the end of this video, I'm actually going to open up some actual records on a real case, very redacted records, and I'm going to share them with you, and we're going to walk through and kind of determine how would you know if those things that are in the records should actually make it into your chrono and report. But first, I want to cover a couple of topics before we get to the records. So let's get started. Okay, so first, why does relevance matter anyway? Couple of points I want to address here. Number one, irrelevant information. If you put in stuff that doesn't really matter to the case, it can muddy the analysis. And what I mean by that is the attorney has to pour through a bunch of stuff that doesn't really matter to try to figure out what does matter. And if you as a legal nurse are putting in information that is irrelevant, it really diminishes the value of the work you're doing because the attorney's still having to kind of pour through to try to pick out those things that we should have done as the legal nurse. Number two, irrelevant information can confuse them. They're not sure if you're putting in information, let's say vital signs, and the vital signs really aren't relevant to the case, but you put them in. That can confuse the attorney. He may be wondering, he or she may be wondering, well, why did the legal nurse put the vital signs in there? Am I missing something? Are they relevant in some way that I'm not understanding, right? So it can confuse the attorney. Number three, it's a waste of your time. You're just wasting your time going through and putting in a bunch of stuff that is irrelevant to the case. And if it's wasting your time, it's wasting the attorney's money. So those are three big reasons why relevance matter. Let's talk about how you know if something's relevant or not. Number one, does the information that you're putting in impact the case? Not, does it impact the patient? And this can get really confusing to legal nurses. I train legal nurses all the time in Catalyst, and this is a normal topic of conversation to determine, like, how do you know, Randy? How do you know if it's relevant? Here's the truth. Sometimes you don't know if it's relevant early on, and that's okay because as the picture starts forming, as you work through your case, then you can go back and determine if something needs to be taken out that you thought might or might not have been relevant. And the question here is, does it impact the case? And then in parentheses, not the patient. So there might be something in the records that absolutely would be important for you to hand off in a report, right? Something that absolutely would be something relevant to document. But it doesn't mean it actually impacts the case at hand. Second, would the attorney read the information out in court? So that's kind of another way to think of, is it relevant? Would the attorney stand up in front of a court and read it out as something that would help their case, or would opposing counsel be able to read it out because it helped their case? And if neither of those is true, it's probably not relevant. And to that point, the third thing, if the information was left out of your chronology or report, so there's something that you're wondering, is this relevant or not? I'm just going to leave it out. If you left it out, could opposing counsel then use that information to build their case, right? So this is kind of flipping it. So is it going to help your attorney, or is it going to hurt your attorney's case? So if it helps the attorney's case, or it could potentially hurt the attorney's case, then it's relevant. But if it's just irrelevant, it's okay to leave it out of your analysis. Now, I want to switch gears here, and I'm actually going to pull up some real records. This is actually straight from a practice case that you get inside Catalyst. And by the way, if you do end up going through Catalyst, if you join our community, what you get is this full practice case, all the records from a real case, 3 of them actually. And then we give you feedback. We teach you exactly how to do what I'm giving you a snapshot of right now. We do some entries together. We have weekly calls where we can discuss and ask questions and troubleshoot. And you actually get 3 full cases that you're going to write full chronos and reports on, and you're going to get feedback multiple times along the way that's individualized right to you that you can keep and watch over and over and over. Enough of that though. Let's get to the records. Okay, so here's the records I want to address with us. And this is just what I just picked a random page in the first practice case that you'll get in Catalyst. And we're just going to do one entry together. It's not actually going to be an entry into your chrono and report. You learned that in the program. But I want to go over this one encounter with you to kind of talk through how do you know if something's relevant or not. Now, this is heavily redacted, but I think it's good enough for us to at least determine how we would know whether something was relevant or not. Now, first of all, you're going to have your encounter date right up here, right? And this is going to be super important to ensuring that you have the correct name of the patient, which is redacted here, and the correct date. Second of all, if you didn't know this already, you've got their age. That could be super important. You've got the time. That could be very important. All of this stuff you're going to put in. Who the provider was. Now, that's redacted here, but that could be very important. How about the insurance? Probably not, right? It's redacted here, but insurance probably not going to be very relevant to the medical analysis on this case. Here's your chief complaint. Is that going to be important? Well, yeah, absolutely. And this one just happens to be a Visco repeat. Now, if this was the first document we were seeing, we might be like, what the heck is a Visco repeat? Well, first of all, Google is your friend. Use Google. You could quickly Google and find out what Visco repeat means. This actually, you'll see that this is redacted up here, but there's actually records before this, and this is a consecutive Visco injection, which we'll see here in a minute what that means. So Walgreens drugstore, don't care. This is the address of the store that's redacted. Probably not very important to the case. The only way it might be, and again, everything I'm going to show you guys, you could argue or make up some story where it might be relevant, which is cool. That's fine. We don't know what this case is about here. I'm not going to go into that with you. You will when you actually do your practice case. But, you know, if this was something that Walgreens gave them a medication they were allergic to and Walgreens is the one being sued, it might be relevant exactly which Walgreens store this was. Otherwise, probably not. Now, you'll see here they're 5'7". That's like the craziest highlight I've ever done. They're 5'7", and it does not tell us their weight. Now, this could be relevant to the case, depending. If they're 5'7", 300 pounds, and let's say that this case has something to do with their health overall, or maybe they fell, or really just about anything. If they are morbidly obese, then it could play into the case. So that actually might be helpful to you. You might want to take that and find a weight and do a BMI if that's not in there. And then maybe do a little research on how BMI might impact the case for or against your attorney-client. All right, so let's move on down here. We are now looking at allergies. Now, would allergies be relevant? Probably not. What might be a case that it would be? Well, if we gave them something they're allergic to, right? Then of course that will be relevant. Otherwise, is it even relevant to put in? Probably not. If this was a motor vehicle accident, there was no issues with their allergies, probably not. How about the medications that they're on? So we could look through the medications and see, is there anything here that would be relevant? There's potential that there is. Most of it, probably not. But I'm looking at it and I'm going, why are they on antibiotics, right? If this was the first thing that I saw, I'd be questioning, why are they already on so many antibiotics? What has happened that now they have to have all these antibiotics filled? And I can see here that this encounter date is 4/4, and some of these were filled like October of 21. This is now 4/4 of 22. All of these were filled in 21. This one, this person's been on prednisone since 12/2 of 20. So something's going on there, right? So I might want to take pause and really think about, is any of this relevant to the case? Maybe, maybe not. That's for us to decide in our analysis. But this is the way that you would go about trying to determine whether or not that information was relevant. Vaccines, none recorded, don't care. Not in this case, probably. Problems. Now, this is getting to some good meat. I'm looking at their problems of what they've had been diagnosed with in the past. And obviously, there's some stuff here that might be really valuable depending on what this case is, right? I've got a tear of the medial meniscus. I've got a rupture of the ACL. I've got a sprain in the ACL. I've got traumatic amputation of the fingertip. So if this is the first record I'm seeing, this could be really golden, right? Chances are you've probably already know this through your analysis of prior records. Family history. Do I care? Probably not. Do I care that mom had AFib, arthritis? Probably not. Do I care that maternal grandfather had back problems and cancer? Probably not. Could I come up with different cases where I might actually care? Yeah, I could come up with things where I might actually care. What if this person was in a motor vehicle collision with no history of AFib and the steering wheel hit them and now they went into AFib? I'd want to let my attorney know that there was a family history of AFib. So maybe she was already predisposed to it. Is it going to change the case dramatically? Probably not. But I would want them to know that. Otherwise, don't care. Leaving it out. How about social history? Do I care about social history? Maybe. Maybe not. I think one thing that I would definitely pick up on here is that they have a child. Why would I care about the fact that they have a child? If, depending on how old the kiddo is, if they now have, well, we know they've got some issues with their knee. Now, we don't know if this is caused by the accident just from this one record. We don't even know if this is an accident, right? I didn't give you guys a scenario. But are they able to pick their kid up anymore? If their kid is a year old, can they pick them up and give them a hug anymore, right? Those are things you'd want to know. How is it impacted? How has the injury sustained in this accident impacted the life with their child and their family? Good question. I don't know, but that will be something I'd be thinking of if I was doing this case. Exercise. They say occasional. Are they exercising now? Now that they've got a blown knee? Was that blown knee even caused by the accident? That could be something that I'd want to take notice of. Have you ever smoked? Yes, I used to. So how much did they smoke? It said, it doesn't say here. It says their most recent tobacco screening was a few years back. They occasionally drink alcohol. Do I want to know this? I want to know it. Is it going into the record? Into my analysis? Possibly. If they're a former smoker, that depending on how much they smoked before, that could decrease healing, right? If they were a 2 or 3 pack a day smoker and they don't smoke anymore, but they quit yesterday, that's a big difference than, I smoked a little bit here and there in my early 20s and now I'm 58. Probably not a big deal. Alcohol consumption is occasional. Probably not a big deal unless this was a motor vehicle collision or something where, hey, let me check and make sure in the police report they weren't drinking, that they didn't have any alcohol consumption that day. Occupation absolutely might matter to me. Depending on if this person's a domestic engineer, I might do a little research to see, is that person walking around a lot? Because this person now has a blown knee. So if that was caused by the accident, it could impact their earning ability, right? They're right-handed. Does it matter? Maybe not. But if they had right hand injury, it could, right? Because now I know that's their dominant hand. So you can see how I'm going through this and kind of picking out things that I think would be relevant. For instance, surgical history. Look at this, guys. Knee surgery in 1992, long before whatever happened here with this incident. So definitely would be relevant to note that knee surgery. Looking on down here, past history, they've had back injuries. They've had a stroke before. Look at that. So this is all relevant stuff that we would want to know. A lot of this stuff, not so relevant. A lot of it, super duper relevant. Your HPI, guys, is almost always going to be relevant. You're going to want to look here, the monovisc injection. That's what that visc injection was saying it was, and you can see exactly what was injected. Now, when you go down to this part, right, monovisc ultrasound, does that matter? Well, this whole thing probably matters here, right? I'm going to want to take note of this whole paragraph here. This paragraph, probably not as much, because this is going over, I obtained verbal and written consent, utilize aseptic technique, the right knee was numb, blah, 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 blah. Now, unless the issue was with this injection or something happened odd with this injection, or if this is a personal injury case and they did this injection completely wrong and harmed the patient, it only matters so much as that it impacts the personal injury side. If they wanted to sue the hospital or this physician, that's a whole different case, right? So it would only be of note, this happened and they really messed this person up because they did something wrong in the hospital. But if it's a personal injury case, the hospital's not the one being sued. The plan could absolutely be important. Why? Because I want to know what to look for moving forward. And I want to see if they're improving or getting worse, right? So now I'm going to look and see what's going to be happening down the road. They were reminded to continue with their HEP, their home exercise program. Did they? Right? I want to know that. Is there any notation about them actually doing it? Were they negligent? It's called contributory negligence, where they're contributing to their own injuries by not following up. Did they get their NSAIDs? Did they use their brace? We're looking for those sorts of things in the records as we're going through them. And then here, return in 3 months. Do we have records from 3 months down the road? If we don't, was it because they didn't go? Was it because it got canceled? Why didn't it go 3 months later? Maybe we just didn't get the records. Maybe the attorney didn't get those records yet. And then we've got our diagnoses here: osteoarthritis, pain in the right knee, and discussion notes may or may not be relevant. I think this is very similar to the assessment plan. Do I need to repeat that in my analysis? No, not if it says the exact same thing. The attorney doesn't need to, they don't care that it's got the same thing under assessment and plan that it does under discussion notes. And don't hear me say that I've read this and see that it says exactly the same. It just, at a quick glance, it looks similar. So I'd only want to put the new stuff that I haven't already said. And then, then you've got what time they signed out and who signed them out. And that might be relevant as well. We can see that this was a 38-minute appointment. So if next time they're in there and it ends up taking 2 hours, I might kind of red flag that in my mind and go, why did it take so much longer? So even those little things can be relevant, but ultimately you only have to put in the things that impact the case. And a lot of this, guys, when you're going through your analysis, you'll hear me say this in Catalyst if you decide to join us. You can go back, right? Make yourself notes as you're working through your chronology report. Make yourself notes and highlight them in some weird color so they stand out to you. Just put, is this relevant, or relevant question mark? And then go back later when you read that full story that you've now tried to pull everything relevant out of all these records. It will make more sense and you can determine, is that relevant? I hope this was helpful to you guys. If you're interested in learning more about Catalyst or about legal nurse consulting, check out my other video that's named How to Become a Legal Nurse Consultant. You can always visit our website at catalystcoachingandmentoring.com. And there's also in the description of this video, there's a link you can click to get some free introductory training and to learn more about what we do at Catalyst. I hope this was helpful to you today.